10 highest paying medical jobs in USA. Employment in the healthcare industry are among the highest paying jobs in the country, and the industry's outlook for the future is quite optimistic. The United States Bureau of Labor Statistics, BLS, projects that employment in healthcare vocations will increase by 16% between the years 2020 and 2030, which would result in the addition of approximately 2.6 million new jobs. According to the agency, this expansion can be mostly attributed to an older population, which in turn has led to a growing need for healthcare services. Number 10. Chief Executives, $213,020. Employment opportunities in the healthcare industry are consistently ranked among the highest paying jobs in the country, and the forecast for the industry's continued growth is very positive. The United States Bureau of Labor Statistics, BLS, anticipates that employment in healthcare occupations would expand by 16% between the years of 2020 and 2030, which would result in the addition of roughly 2.6 million new jobs. This expansion, as stated by the agency, may primarily be attributable to an older population, which in turn has led to an increasing need for healthcare services. Number 9. Family medicine physicians, $235,930. The Bureau of Labor Statistics defines the physicians who fall into this group as those who diagnose, treat, and offer preventative care to individuals and families throughout their lifetimes. These primary care physicians frequently refer their patients to specialists for more specialized treatments. Patients often visit family medicine professionals, who are also known as primary care physicians, for routine checkups and treatment of common health problems such as sinus and respiratory infections, as well as long-term conditions such as diabetes, asthma, and heart disease. Certain general practitioners focus exclusively on either adults, internists, or children, pediatricians. Family physicians are noted for their ability to care for patients of all ages, from infancy all the way up to the golden years. Family practitioners typically treat a greater variety of medical conditions than other types of doctors since their patient populations are so diverse. Number 8. Internal medicine physicians, $242,190. The treatment of adult patients is the area of expertise of internists, who frequently work as primary care physicians or as hospitalists. As is the case with other types of general practitioners, internists who work in primary care settings see a high volume of patients and must be able to manage a wide variety of conditions. These conditions can vary from asthma and diabetes to high cholesterol and high blood pressure. Because visits only often last 15 or 30 minutes, the ability to make snap decisions is an absolute requirement. Number 7. Psychiatrists, $249,760. Although all psychiatrists contribute to the treatment of mental health problems, the subject of psychiatry encompasses a wide variety of subspecialties. Some focus their careers on child and adolescent psychiatry, for instance, while others choose to become experts in forensic, legal, psychiatry, addiction psychiatry, or consultation psychiatry, which takes place in a medical environment. Some people choose to specialize in psychoanalysis, which is a form of therapy in which a psychiatrist guides a patient through the process of recalling and analyzing events and feelings from their past in order to better comprehend how they are currently feeling. It is possible to find psychiatrists working in a wide variety of settings, including private practice, hospitals, community organizations, schools, rehabilitation programs, and even correctional facilities. Number 6. Physicians, other $255,110. They would come in 6th place if you were to take the mean wage of all physicians working in all other specialties and compare it to what they make. This other category encompasses a wide range of professions, including allergists, cardiologists, dermatologists, oncologists who treat cancer, gastroenterologists who specialize in the digestive system, and ophthalmologists, amongst others, eye specialists. In addition, it includes radiologists and pathologists, the latter of which examines medical images and the former of which treats cancer patients with radiation treatment and examines bodily tissues for probable abnormalities. Before moving ahead, please like this video and subscribe to this channel for our future updates. Number 5. Orthodontists, $267,280. Orthodontists are dental specialists who focus on corrective procedures for the teeth. Patients typically are referred to them by their general dentists. These dentists routinely use X-rays, fit patients with braces, fabricate mouthguards, and carry out a variety of other operations as required. Because they interact directly with patients, orthodontists who want to be successful need to have strong analytical and problem-solving skills in addition to excellent communication talents. Others run their own practices, which necessitates excellent management abilities on their part. Some work for large orthodontic offices, while others are self-employed. Number 4. Surgeons, $294,520. Even though becoming a surgeon takes several years of specialized training, these top-tier professionals are rewarded with one of the best salaries in the medical field. Depending on the area of specialty they choose, surgeons may find themselves working long and unpredictable hours. Surgeons who specialize in preventative or elective procedures may have a schedule that is easier to plan. However, those who work in specialties such as neurosurgery or trauma surgery frequently put in long hours, which may even include working overnight. Surgical procedures, such as removal of cancerous growths or repair of fractured bones, are performed by surgeons. Surgeons contribute to the management of the patient's care both before and after surgical procedures. A surgeon may be required to address patient concerns over the phone even when they are not scheduled to work, and on-call surgeons may be required to make unscheduled visits to a hospital in the event of an emergency. Number 3. Obstetricians-Gynecologists, $296,210. Obstetrician-Gynecologists, also known as OB/GYNs, are medical professionals who specialize in the reproductive health of women's reproductive organs, including the vaginal, ovarian, uterine, and cervical regions, as well as childbirth. Their annual wages are comparable to those listed for general surgeons. Successful obstetricians and gynecologists are skilled in imparting knowledge to patients in a way that benefits both the patients and their children's health. They are also quite skilled at coping with high-pressure situations, the most notable of which is giving birth, which can take place at odd hours of the day. To become an OB/GYN, one must first graduate from medical school and then spend the following 4 years completing residency programs in both obstetrics and gynecology. Both of these programs normally span for 4 years. These physicians are required to pass a licensing exam after having completed 2 years of clinical practice. According to the estimates provided by the BLS, the number of positions held by OB/GYNs is anticipated to fall by 2% between the years 2020 and 2030. Number 2. Oral and Maxillofacial Surgeons, $311,460. Oral and maxillofacial surgeons treat a wide variety of conditions, including diseases, traumas, and birth defects that can affect the mouth, jaw, and surrounding areas. Wisdom tooth issues, malocclusions, jaws that aren't aligned properly, tumors and cysts of the jaw and mouth are some of the more prevalent conditions that they are likely to treat. They may also carry out surgical procedures involving dental implants. Oral and maxillofacial surgeons are required to have a bachelor's degree, a dentistry degree that takes an additional 4 years to complete, and at least 4 years of residency. After completing their training, surgeons in the United States often need to pass a 2-part exam administered by the American Board of Oral and Maxillofacial Surgery in order to become certified. According to the estimates provided by the BLS, the labor force should grow by 8% between the years 2020 and 2030. Number 1. Anesthesiologists, $331,190. Anesthesiologists are physicians who, according to the BLS's definition, administer anesthetics and analgesics for pain control prior to, during, or after surgery. This highly specialized field of work has risen to the top of the list of highest-paying occupations. Anesthesiologists follow the schedule of the operating room, which can be lengthy and unexpected at times. Their work hours reflect this. This is due to the fact that anesthesiologists are required to be present throughout both planned surgeries and unplanned treatments, such as those that are carried out in response to traumatic events and births. Aspiring anesthesiologists in the United States must normally complete a 4-year residency in anesthesiology and maybe even more, depending on the specialization they choose to pursue after completing their initial 4 years of medical school. The BLS forecasts that there will be a 1% decrease in employment from the year 2020 to the year 2030. What do you think about our video? Please let us know in the comments area below. If you enjoyed this video and would want to hear from me again, please subscribe and turn on the notification before leaving. Thank you for watching us.